So I am a senior internal medicine resident, and I practice mostly at the University of Minnesota, as well as a community hospital called Regions and a VA hospital in Minneapolis. Most of my practice is done on the inpatient side, so in the hospital. However, I do have a little bit of clinic outpatient practice as well.
And do you use an EHR in your daily kind of day-to-day practice?
Yes, we have Epic at the U and Regions, and then we use CPRS at the VA.
Okay, fantastic. And when you're within the EHR, is there anything that you're being provided in terms of kind of real-time analysis of patient data or any sort of clinical data to aid you when you're providing care?
Nothing direct. Sometimes we do have these things called order sets. I think the individual institution has to come up with them, but they still leave the decision making on the clinician. It's just kind of like almost like a checklist.
Would you use more clinical decision support tools if you had them at your discretion?
I would. I mean, a big part of what we do is assessing risk and trying to figure out, like risk versus benefit, because a lot of people think medicine is really clear cut and black and white, and it's really not. So a lot of times we do have some like scoring tools that we use to try to assess risk. But the hard thing is you have to remember all these things. You have to know when to implement them. So having some type of like supportive software to like prompt you or to automatically apply them would be extremely helpful, I think.
Do you feel like you spend too much time in the EHR?
Absolutely. Yes.
Okay.
Yeah, I'd say probably 80 to 90% of my day is actually on the EHR.
All right. Well, I'm going to shift gears and show you the Charlton Copilot is the name, but basically it is a clinical support utility. It's incredibly powerful. The AI engine that's backing this technology, it's incredibly extensible and flexible, so it can fit regardless of the EHR you're using open source APIs and different technology like that. And then it's incredibly flexible as well. So regardless of where an inpatient, outpatient setting, it's really going to enhance the practice and the awesome care that you're already providing. So really, again, it goes back to the idea of collecting better data, reducing risk, either how you collect the data or interpret the data, and then eliminate any time that you're wasting on the chart or within the chart. So basically, it comes down to a little bit of software and a little bit of hardware. On the hardware side, there are going to be different audio inputs and video recording devices, depending on where you are with your patient. This is just a basic setting, but it can be expanded to anywhere really within a hospital, inpatient, outpatient setting, like I said. It basically encourages and enables automatic charting because all the data that you're collecting when talking with your patient, it's going to be interpreted, and basically as the engine matures, it's going to be able to interpret that data with higher and higher accuracy and giving you more and more feedback. So obviously then with that data can be used to enhance clinical decisions, and that's all at real time. And then in the end as well, because you're going to have more time with your patients, it's going to improve patient satisfaction and outcomes as well. So you can see this is a basic setting of just a NP, maybe a physician with their patient. You can see the audio and video still recording. The EHR is up in the background. And then from the Charlton Copilot perspective, we're just sitting on top of the EHR, so it's going to look and feel like you're working within the EHR. And then as you can see, anytime anything is spoken, Cindy Peterson is the patient's name. It's going to pull up her chart automatically. And then from there, any sort of information that the engine deems is appropriate and clinically relevant, it's going to provide more information. So if the physician says images, for example, any of the patient context is going to be brought up. The most relevant, obviously, first to give you kind of that longitudinal record of all the images collected and taken throughout the patient's life. If you get more specific and say pelvis, you can get a very large picture of the patient's pelvis. When discussing with the patient, for example, that you're going to be needing some surgery, there's going to be some surgery, there's going to be a closed reduction surgery of the right hip. Right away, the system is designed to bring up a risk analysis and give you a better idea of things you should be aware of going into that surgery.